Today we have the man himself, Sir Dr. D. Narayana Reddy. Thank you so much, sir, for coming here and giving us time. Sir, this is about awareness around sexual dysfunctions and their treatment. So first, I would like to know, sir, if you can throw some light that how are sexual dysfunctions having impact on people's life?
Today, the World Health Organization included the word pleasure in its definition of sexual health. So the days have gone where we were talking only about health. Health basically means absence of a disease or infirmity.
That's true.
Whereas when you use the word well-being, it not only includes health, it includes comfort and happiness.
True.
Now, from that stage, we are now progressing to this. Now, what has happened, unfortunately, is the authorities and education authorities, they are more shy than the general public.
Right.
It is like the dictum, the physician is more embarrassed than the client.
True.
The reason I'm telling you, the general public realize that they have a problem. They're actually looking for a good quality help. Since qualified people are not available, they are going to quacks.
That's true.
So I will not say people are not aware, but people are not aware of where good quality help can come from.
Very true, sir. Very true. I think this is the reason why, Curix came into picture, because we understood that people don't know where the good quality help they can actually reach out for. So, sir, out so many years of your practice and so many years of teaching so many people around sexual dysfunctions and treating them, what do you think that out of 100 people who are struggling with sexual dysfunctions, how many of them come forward and ask out for treatment in the hope that they will get treated?
I've been lucky enough because from day one I've been known as a specialist in managing sexual dysfunction. So people come to me with that expectation. People come to me with that expectation. I have no problem. But what I am trying to say is that the medical fraternity has to recognize, accept is a important branch of the holistic medical practice. That is not available at the moment. Take for my example, my own experience.
Yes.
I am now compiling the data of my 40 years of clinical practice, especially in sexology. I found that about 30 to 40% of people are referred to me by their relatives, by their friends. It means that they are talking to each other.
Very nice. That's such a good thing to hear that, okay, now people are finally talking and they are seeking the right solution. Sir, when we say treatment of sexual dysfunctions, I would talk about the most prominent ones because we see erectile dysfunction, premature ejaculation, now coming up masturbation addiction, low sexual drive, and we just talked about vaginismus. So for all these problems, I know, I can understand that the treatment is very subjective to the root cause of a problem. But what do you think is the best combination of treatment? Because in India, people just want, give me pills, I would take the pills and I should be fine. So how do we tell these people that in sexual dysfunctions, only pills won't work? How do we tell them that why is it important to talk about your mental health, your bodily health, and your complete emotional health?
I think the problem lies with the medical fraternity rather than the public. Because the way the newer drugs are being promoted and the way the doctors are practicing, they are drug oriented.
Right.
Because that's the way they are able to handle it. I'm giving an example. When the sildenafil citrate came into the market, the many Indian companies started manufacturing. Now, if you see their initial brochures, what do they say? For a physical cause, for a psychogenic cause, or for a mixed cause, use our band pill.
Yeah.
That means the doctor need not bother to find out what the root cause, simply blindly prescribe. So when doctors believe that, and people are also taken by that because media only highlights the newer drug inventions, surgical inventions, rather than talking about holistic sexual health. That's where the problem lies.
Very true. And sir, if we have to tell the patients that, uh, boss, your sexual dysfunction or your sexual issue which you're dealing with will not get solved like this, how do we tell them that you have to be patient? You have to stick with us. It's a journey. It's not a treatment. It's a journey. Sexual dysfunctions. What do we tell them that they understand that yes, we need to stick through to the journey?
If they come as a couple, we have a better chance.
Right. Very true.
And if the couple are motivated, not influenced by others, we got a very good chance. But the couple come to us quarreling with each other, then you can't ask them to be patient. Because unless you give a quick remedy, the relationship will not mend. Second thing. The third most important thing, what has happened is, once these drugs have come into the market, people's expectation also has changed. That is because we doctors are not able to tell them that this is only part of it. If you take me, for example, in my practice, before the advent of this sildenafil citrate or Viagra, when I offered them sex therapy, most of them accepted it.
Wow.
But once this came, there was a lot of resistance to accept that one for two reasons. This gives a quicker result. Second thing, this is cheaper. They are not bothered about long-term effect. They want immediate results.
But then they'll have to come back for the treatment, isn't
They
it?
will come back later on. See, those people who are placing importance in relationship, they will come back.
Yeah.
Those who are not. In my experience, men are performance oriented, women are relationship oriented.
True.
That's why I said when they come as a couple, we stand a better chance. So now what I do is I do integrated therapy. That is, I do prescribe them medicine to satisfy that expectation. At the same time, also undertake psychosexual therapy and combination of both. That works better.
Wow. Great, sir. Sir, just last two questions. I know I can't take much of your time. One, that how many months generally does it take if the patient is dedicated for medicine plus therapy? How many months does it take generally to solve, I would say on an average, to solve a problem, solve a sexual dysfunction?
If they are dedicated, without medicine, if it is psychosexual problem, it's about 3 to 4 months.
Okay.
If I'm going to add a drug, then 2.5 to 3 months.
Okay. Wow. So if a patient doesn't want to have a drug and they just need to, and they can, if they can be treated through psychotherapy alone, it would take at least 3 months.
3 months.
Otherwise, if they can take a drug together with the therapy, then 2.5 to 2
Months.
months. Wow. So just before your message to the people, last thing, can only medicines, people who have, for example, how many percentage of people would have problem related to only their body vitals and which can be treated only with drugs?
The question is, what is that we are looking at? Now, for that, the doctor or the therapist have to ask one simple question.
Right.
Why do you want to have sex? The key lies in the answer you get.
Right.
If somebody wants to prove himself, then probably drug may be more useful.
Yeah.
But if somebody thinks the relationship is affected because of this dysfunction, then drug alone is not going to help. And if they think that by improving their performance, their relationship will become, then I wouldn't prescribe them drugs rather than undertake only the relationship therapy.
Very good, sir. So your message to people who are struggling with sexual dysfunctions and they have been raised up in a way that if there is a problem, medicines is the solution. So for people who are struggling with sexual dysfunctions, what would be your message to them?
My message is simple. You leave the choice to the therapist. You don't decide what type of therapy or treatment should be given. Let the therapist or the consultant decide what is the cause of your problem and which is the best mode of therapy which will suit you. You accept that rather than imposing your expectation on the consultant.
Wow, wow. Thank you so much, sir.
Thank
I
you.
think it was a great conversation and a very important conversation for people who are struggling with sexual dysfunctions. I think it will, at least, even if it helps 10% of the people to accept therapy along with medicines, I'm sure a lot of lives will improve.
Correct.
Thank you. Thank you so much.